I hope y'all can see me all right. Unfortunately, I can't see anyone, so I'm just gonna hope that it all works. All right. Some folks are pinging me to say it does work, so hopefully it's all good. So I'm gonna surprisingly not be talking about technology today. I'm going to be talking about how we can help with the COVID-19 pandemic and what we could potentially do to help everybody who is facing issues right now. And I think this talk might be shorter than 30 minutes, but my goal here isn't to overload you with information. It's to give you some ideas on what you could potentially do to make things better. So I'm going to get started by introducing myself. So my name is Sasha Rosenbaum. I'm a product manager at GitHub. I'm on Twitter as DivineOps, so feel free to give me feedback there as well. I've been using this picture for a while in my sort of introduction slide, and I considered changing it for a less happy picture. But I think it's important to sort of still have happy moments. And this picture, by the way, is from DevOps Day Chicago, which is going to happen on September 1st and 2nd, whether it's live or virtual, we don't know, but it's going to happen. So you can all join us there as well. So I am not an epidemiologist or economist or doctor or any type of person that you typically see on the pandemic response teams, right? So what gives me credibility to talk to you today, I guess, is the biggest thing that I'm a human and I care. And I think that's why we're having this conference, which is hosted by SNCC and community members who want to contribute to the response to this pandemic, to the efforts, and just want to raise money or maybe just collaborate and, help other people in this tough situation that we're all in right now. So to get us started, I want to sort of talk a little bit about what the pandemic is. So we're just going to look at data that, again, I think you probably have all seen before, but it might be sort of a useful refresher for some folks who might have missed some news or just a kind of a level setter for us. So this is a map from the World Health Organization website on the current situation. This is from yesterday, so this data may have changed a little bit. But we have close to 2 million confirmed cases, and we have over 100,000 deaths from the virus. So basically, we're in a very, very bad global crisis right now. And this is the first pandemic such as this one in the last 100 years since the Spanish flu. So basically, we're facing a crisis that none of us probably have experienced in our lifetime. And one of the questions that I had in the beginning and that I heard from a lot of people is that what's different about this, right? We have flu every year and it kills many people and it also spreads globally, and we have different versions of flu coming out. And so basically different strains. So basically what's the difference? So some of this data is still in research, so we don't actually know some of these numbers. But first of all, we talk about how, potentially the number of infected people from COVID-19 is higher. Also that the fatality rate might be higher. But again, this is something that we potentially don't know because we might not be aware of all the cases of all the people who've been infected. So that would affect the number for the total mortality rate. I think that one of the biggest numbers here is the 1 to 14 days incubation time. So typically the flu has a much shorter incubation time, so people are not contagious for an extended period of time. Whereas in the in the case of COVID-19, people can be contagious for about 14 days without having any symptoms. So that's a major problem when people get infected. And also some cases, it's been reported that people don't experience symptoms at all. So we might not even know that we're carrying and spreading the virus. And so basically we are facing this highly spreading pandemic. And the biggest thing that's the difference here is that none of us has immunity to this, right? So we've never encountered this. So in theory, almost every one of us can contract this at this time, and we have no vaccine, and we have no medical treatment for this. And I think for a while there, everybody was talking about how we were gonna, develop herd immunity, and everything is going to be okay. We're just gonna sort of carry on. But then, I think this was when the pivotal studies that came out on, I believe, March 16th. And so basically this was a study from Imperial College in UK that modeled what different responses to this pandemic are going to cause. And so we can see that the black line is a significant surge. It is if we don't do anything to address the pandemic, then we would overload. So the number is 30 times greater demand for ICU beds than capacity, right? Which means that a lot more people die and a lot more health professionals get completely overloaded with this. And then there's a whole different models of different responses that we could have. And this was modeled for UK and the US in terms of response. And both of them, basically the only viable option was shown to be home quarantine and social distancing, and basically most people staying offline. Am I still okay on all the, okay. I think I'm okay on presentation, so hopefully if not, then people will let me know. So that's why people talk about flattening the curve, right? So if we embrace social distancing, we flatten that curve, which means not all infections come in at the same time, which means that we don't overload our healthcare system, which is also very important, not just for basically our response to this illness, but also for other illnesses, because we can be talking about having, someone having a car accident, and if all the ICU beds are taken, then there's no one to take care of them. So we are social distancing right now, and the social distancing in itself introduces some challenges, right? So basically I could talk for a year about this, and this is part of it is already happening and part of it is projected, but basically we have people dying, we have healthcare systems overloaded, we have economic slowdown, we have disruption of travel, closing of borders, hospitality industry, lots of unemployment, lack of childcare and school closures is very hard, especially when we're talking about the fact that some people are essential workers and they can't get childcare. So stuff like that. And we also seeing sort of rise of xenophobia and racism around the world because people are looking for someone to blame. And one other problem that I wanted to know is increase in domestic violence, because there's lots of stressors in the pandemic, and those people are in lockdown, and it increases the cases, and the response is limited at the moment. So we have lots of problems. I am noting also potential positives. So we're seeing already reduced air pollution. So hopefully that kind of stays on, and we don't start catching up and ramping up production so much that it all cancels out. We're seeing acceptance of remote work, which I think enables a lot more people to participate in the economy that weren't able before. And we're seeing deregulation of certain services that previously required being on site. So that may be effective for the long term, because we figured out how to give people healthcare or government services without them having to attend a certain facility. And we're seeing a lot of response from people basically just coming together, right? And so Anne talked about it earlier in the morning about the fact that we are seeing this dramatic response and not being selfish about this. So I want to play a video for you all.
Nurses are the real-time heroes, and they are at the frontline heroes.
My motivation was just helping people.
Someone that can sacrifice his life to save someone's life.
I love my job, my work.
We have COVID patients, they're trickling in.
I saw the city that became silent in these weeks.
It's so busy. I think that I spend a lot of time with COVID-19.
We started to apply all the measures to avoid the contact, and all of a sudden I am infected.
The influx of patients and is really, really overwhelming.
간호사라는 소명의식이 가장 큰 힘이라고 생각합니다.
We're seeing services transform overnight.
Surgery wards became COVID wards.
We have a clinic in the garage, totally detached from the main hospitals.
Y son las enfermeras las que están a su lado, o a veces consiguen hacer videollamadas entre el paciente y la familia para que puedan despedirse, puedan hablar.
Our labs have been informing us that they are slowly running out of test kits.
We're working on making the videos for donning and doffing of PPE, how to wear a mask properly.
We still have a shortage of nurses.
If we can have enough staff and provide the right equipment, I think it will be easier to care for the volume of patients.
Take our ideas into account and listen to us.
The care is still there. You can still say, even behind a mask.
To my colleague nurses, I want to say, you just inspire me.
We are motivated because right now, if we don't do it now, I don't think there'll be another chance for us to do.
Please stay home for us.
We've got this, and we can do this. It's the nursing that will make such a difference.
So this was a video by WHO, the World Health Organization, and so they are basically, doing this response. And one of the main features of their response is helping healthcare professionals around the world and helping them with protective equipment and other resources. And so I think this is like a very, very important effort because it helps people stay alive. Both the healthcare professionals and the people who are sick. And so it improves basically the situation for all of us. So I want to now switch gears into what you can actually do to help. So there's a number of things that we can do. And let's get started by this one. So you should embrace taking care of yourself. And if you have a family and pets and close, friends who need help, just taking care of them. So it's actually is very, very important. And self-care isn't selfish. And if all you can do right now is just take care of yourself, make sure that you properly, have the psychological care and the physical care that you need, and taking care of elderly relatives and children and stuff like that, that is enough because you're part of humanity and you're helping the humanity by just basically taking care of you and your family. But then obviously we can embrace bigger things. And I think every religion in the world has some sort of saying that's similar to this one. If you want to be happy, practice compassion. If I took the full quote is, if you want others to be happy, practice compassion. And if you want to be happy, practice compassion. And that's by Dalai Lama. And I think we see a lot of times that when the circumstances are very bad, we sort of close up and we stop paying attention to the world outside and we just basically focus on ourselves. I had a fairly rough childhood, and I remember my mom always saying, hey, we can't help other people, we need help ourselves, right? And it took me a few years, but I found out that this wasn't true because when you help other people, you kind of magically discover different resources and you actually become happier. And so there's actually lots of research on that in terms of how helping others actually helps you. So I also want to quote another, like maybe a little more lighthearted quote, but if you think you're too small to make a difference, try sleeping with a mosquito. And that's also by Dalai Lama. But basically, I have the resource slide in the end of this talk, and there's some links on studies in terms of how volunteering and donating and giving in various ways basically just improves your health, and it like lowers your stress levels and blood pressure and stuff like that. So even if you thought that you don't have the resources to help others, that very help might be helping you as well. And also it is nice and awesome to help others as well, not just for yourself. But yeah, so you could donate money or time or resources. And I think, from the people who may be watching this video, I think all of us have one or all three of these resources to donate. And so we can always find some ways to give and donate to other people who have a harder situation than ourselves. So I do have links at the end, and I'm going to cover the things that you could be doing. So you can volunteer in your community. So communities right now need a lot of help. So things like food banks and things like, grocery shopping for elderly neighbors, and volunteering at hospitals, and, volunteering on phone support lines for people in critical situations. Blood banks need donations and stuff like that. So we basically are talking about like lots, because of social distancing and because of limited resources. These organizations also have limited volunteers. And so there's a lot of need right now. Now, I can't give you resources for your local volunteering options effectively. I do have a link for volunteer match at the end for the US. But basically, just a simple online search will give you tons of options on different things you could be doing for your community. And that's if you have time to volunteer, that may be a good option. And if you're not in the risk group and you could, envision being around other people. You can also volunteer online. So I'm guessing most of us are technical professionals. There's a lot of projects going on right now contributing to COVID-19 efforts. So just to give you a couple of examples, there's the, this is an open project for the global trend map. The Johns Hopkins map is also not open project, but there's also other things like the WHO is trying to develop a mobile application for that. And there's self-assessment trackers and lots of other things. Again, I have a link at the end to some of the open source projects that we've been tracking at GitHub that are basically focusing on the COVID-19 response. So if you are at home and you're a technical professional and you can volunteer for one of these projects, you are going to be making a difference here. There's another thing that you could do basically by clicking a button. So Folding at Home uses people's personal computing resources when they're on idle to do various projects, various charity projects, such as medical, drug modeling and stuff like that. They have a COVID-19 response track as well now. So you can install it on your computers and basically be donating to COVID-19 response without doing anything except for donating your CPU power. You can donate, obviously, to charity focused on the COVID-19 response. This conference is donating to the World Health Organization, which is contributing very, very significantly to the world efforts to battle this emergency. And I think I don't want to politicize things, and lots of people are critical of every charity that we could think of. But I think first of all, we can see that, just the levels of protective equipment that they ship to various countries, and especially to poor countries who can't afford this type of care, is very major. And also just coordinating response between countries, like learning the things that are known already in China so they can help other countries that are facing this emergency right now, and things like that. If you don't like the World Health Organization, there's other charities, global and local. So there's, Doctors Without Borders and Red Cross and all sorts of things. And again, also local charities that are helping communities with this response. You have a donate button right here at the stream. So you could obviously go and it shows up as a ticket, but really this money is going towards the World Health Organization COVID-19 Response Fund. And then you could donate to a charity that is not focused on COVID-19. I know it may sound surprising, but it's actually, those charities are right now facing a very tough time finding donations, because most of them get donations from fundraiser events. So as an example, this is from the Guardian article. There was a London Marathon that last year raised 66 million pounds. It's not happening this year. So obviously that's a problem for raising these donations. And again, most every charity I know has fundraisers that are now being canceled. So if you have a favorite charity focusing on whatever it is, education, water supply around the world, stuff like that, you can obviously help them out by donating to them as well. And then if you're in a position to do this, and I think most of us, have some ability to influence our corporate leadership, you can encourage the corporate support. I am quite frankly humbled by the level of corporate contributions right now. So for instance, Microsoft on the March 5th announced that they will continue paying their vendors throughout this time, even if the vendors are not clocking in hours. So, and then basic companies like Amazon, Expedia, Facebook, Twitter, Google, and others followed suit as well. So these people are getting paid, and that's a choice by corporations to continue pay their hourly workers and vendors. It's also, so the picture here is Microsoft is donating the lunches from the cafeteria that typically serves the Microsoft workers to local schools. So local Feed the Schools program. So they're collaborating with them. I'm sure other companies are doing something like that as well. Uber Eats and Grubhub. So Grubhub is suspending delivery fees from independent restaurants. Uber Eats is waiving delivery fee from independent restaurants to help them sort of stay afloat in this time when people don't dine in. CVS is delivering prescriptions for free, and they're also enabling people to get the prescriptions more than 30 days in advance, where it's usually restricted. So there's lots and lots of different examples of corporate responses where people are just choosing to donate massive amounts of money and work time to contribute to these efforts. And you can read more about this. So again, if you have an ability to do this, and some employers also do corporate match for donations. So I would encourage you to check if your employer is doing that as well. And then obviously staying home is important. So I'm going to play one more video if it starts or if it doesn't. All right, good.
Throughout history, humankind has prevailed in our darkest moments, coming together to face the very thing that would extinguish our light. This is not one of those moments at all. This is a moment for pretty much the opposite. For hiding, for laying low. Napping is also good. Saving humankind by really, really not getting near it. Where playing games, staring at screens, staring at anything, all are the stuff of heroes. Every generation has its moment, where individual sacrifice makes way for the good of those who will come after. A higher purpose. This one is ours.
So, yeah, I think this is our heroic moment here. So these are the resource slides. I will share the link to my presentation online so you can find these resources. So there's data sources and then the resources for open source projects and links to volunteer or donate. And thank you all so much. And I'm going to try to switch over to questions unless someone wants to read them for me. Simon, do you want to read them?
I jumped in just to see if there's, say if you aren't asking questions and then answering straight away. So if anyone does have any questions, please do drop them straight into either the Slido, or if you prefer, we also have Slack here as well. So just looking through some of these. Not sure we have too many questions yet. How's it affected in terms of GitHub yourselves and from a work point of view? How have you seen the effect there in terms of most of the company working remotely anyway, or is it even despite that is it affecting the dynamic too much?
Yeah, so I get the corporate communication for both GitHub and Microsoft, so that's an interesting one. GitHub used to be a remote company, so this is not new, but the scale at which people are working from home is new. And then Microsoft is kind of not a remote-friendly company. Like, only some teams are remote. Most teams are by design co-located. And so this is kind of a new thing for people to be working from home. I think the important thing about this is that I see a lot of encouragement from leadership, basically reiterating that, hey, we understand that you're home with your kids and that you can be 100% productive and we can't be shipping as many features. And maybe, again, reliability right now is more important because we're seeing an uptick in all the online usage of all the services, right? So that's another thing that we're sometimes focusing on reliability even more than pushing new features right now. And I think if you're in a leadership position, that's very important to not just say it once, but keep sort of posting that communication. Hey, we're with you. It's okay. It's going to be okay. We know this is a tough situation for everybody.
Mm-hmm. Sounds good. There's no other questions, I don't believe, in either Slack or Slido. So
all right then, and we are at time. So this is
we have a very, very short time, so I'll leave it up to you, Sasha.